The third heart sound occurs in early diastole, shortly after the second heart sound, as shown by this phonocardiogram. Listen to a patient with the third heart sound. I will begin with 3 normal beats and then add the third heart sound. The third heart sound is heard best at the cardiac apex with the patient in the left lateral position. In those over the age of 40, a third heart sound usually indicates decreased left ventricular function. A third heart sound is usually heard with the bell of the stethoscope at the apex. This sound occurs as a normal variant in children. A third heart sound may also occur as a normal finding in young adults. Patients over 40 who have a third heart sound usually have a decreased ejection fraction. A third heart sound can be difficult to detect because it occurs in the shadow of a louder second heart sound. A third heart sound can occur in volume overload states such as mitral regurgitation. A third heart sound may be palpable at the cardiac apex. In summary, third heart sound is a low-pitched, early diastolic sound heard best at the cardiac apex using the bell of the stethoscope with the patient in the left lateral position. The fourth heart sound occurs in late diastole, shortly before the first heart sound, as shown by the phonocardiogram. Listen to a patient with a fourth heart sound. I will begin with 3 normal beats and then add the fourth heart sound. The fourth heart sound is heard at the cardiac apex with the patient in the left lateral position. A fourth heart sound indicates that a ventricle is stiff and non-compliant. A fourth heart sound may be palpable at the apex. A fourth heart sound feels like a double impulse at the cardiac apex. When a fourth heart sound is added to a normal first and second heart sound, a triple rhythm is created. Although a fourth heart sound is due to a forceful atrial contraction, it actually originates in the ventricular wall. The most common cause of a fourth heart sound is hypertension. Poorly controlled hypertension leads to left ventricular hypertrophy in many patients. In summary, a fourth heart sound is a low-pitched, late, diastolic sound heard best at the cardiac apex. Summation gallop. As the heart rate increases, a third heart sound from one cardiac cycle may coincide with a fourth heart sound from the following cycle. In this case, a single loud diastolic sound is heard as the two sounds superimpose on each other. Listen to a patient with a summation gallop. I will start with 3 normal beats and then add the summation gallop. Summation gallops are usually heard best at the cardiac apex with the patient in the left lateral position. The most common medical conditions where summation gallops occur are end-stage dilated cardiomyopathy, end-stage ischemic cardiomyopathy, or left ventricular aneurysm. On occasion, A patient may have both a third heart sound and a fourth heart sound. At heart rates below 90 beats per minute, there can be a quadruple rhythm. Listen to a patient with both a third and fourth heart sound. I will start with 3 normal beats, and then add the third heart sound, and finally the fourth heart sound. At cardiac catheterization, the third heart sound occurs during early peak ventricular filling, and the fourth heart sound coincides with atrial contraction. A summation gallop is located midway between 2 cardiac cycles. At these heart rates, it is easy to confuse systole with diastole. Many clinicians use the onset of the carotid pulse to time systole in this setting. Some patients with a summation gallop may have only a third heart sound or only a fourth heart sound when the heart rate falls below 90 beats per minute. Listen as the heart rate of a patient with a summation gallop decreases to reveal an underlying third heart sound. In general, summation gallops are usually louder than either a third or fourth heart sound alone. Listen once again to a patient with a summation gallop. In summary, above a heart rate of 90 beats per minute, a third heart sound can be superimposed on a fourth heart sound to create a loud summation gallop. Slowing the heart rate can allow one to distinguish whether the gallop is a third sound, a fourth heart sound, or both. Listen once again to a patient with a summation gallop.